Seasonal flu kills tens of thousands of people each year. As our Steve Steger found out, there is a reason why the coronavirus has created a different sense of urgency.
What about the flu, you ask? So far this year, the CDC estimates there have been at least 32 million cases of the flu, resulting in at least 18,000 deaths, a far lower number than the current 43 confirmed cases and 6 deaths associated with coronavirus in the U.S.
Flu is a known devil. We've had the flu around for many, many years. We understand how it works. We have vaccines to prevent the flu.
9 News medical expert Dr. Pyle Coley says there's a reason it's getting so much more attention.
With the coronavirus, it's an unknown devil. So there's so little that we know about it. It's a rapidly evolving situation, and we're learning very quickly about it.
The preliminary study of coronavirus, predominantly in China, found its death rate around 2%. That's high compared to the seasonal flu, which is usually around 0.1%. Though a wider study of coronavirus patients found a lower mortality rate, about 1.4%. And Dr. Anthony Fauci with the National Institutes of Health says that rate is likely to go down as more mild cases of coronavirus are diagnosed.
We're still learning about how it's spread. We think it's respiratory droplets, but there could be other sources of spread as well.
That's just it. There is so much we don't know and don't have. There's no antiviral treatment for it yet, no vaccine. That's part of this process, Dr. Coley says, and why we should be paying attention.
It's an inevitable part of evolution that we face new diseases.
The flu and coronavirus are different in many ways, including the impacts on kids. Now, that initial study of the disease in China found kids infected by this tend to only have minor symptoms, Kyle, where the flu really impacts kids and can even kill kids.
We have to stress to people that because this novel strand has only really been studied in China so far, everything we know about it comes from China, like the fact that it disproportionately affected men there, but there are cultural issues.
Yes. In fact, even the susceptible particles in the lung, it's found that people in Asia might actually have more of those particles in their lungs, Dr. Coley told us today. So that's one of those things that it's such a small sample of people right now. As it widens out and more studies come in, we'll start to get a better idea of how this disease impacts everyone.
And so many men in China smoke, whereas women in China tend not to. Obviously, things are different here stateside. Keep looking at the best research and give people those facts.